Lovely. Thank you, Andre, and thank you everybody for joining this conference. I greatly appreciate the invitation to be here, and it's lovely meeting all of you. So, yes, that was a fantastic intro, Andre, and hopefully I can share a little bit of my experience as well. So I'll just put the next slide on. I think I'm in control here. So what we'll be talking about today, it's a history of aged care in Australia, the story of aged care assessment and person-centred care, which has been really pleasing to hear such a strong theme today, the journey towards accreditation standards and quality of care and accreditation reports. Where were we and where are we now? So I'm being invited here to tell very much an Australian story about this. And the journey from 30 years is because where we are today certainly wasn't where we were 30 years ago. Before I move into that, though, I want to just share a little bit of my history. And you mentioned that I spent 10 years working in ICU and nurse educator, but the formative years for me was when I was a nursing student. This was back in 1990 when I started. I spent every weekend, Saturday and Sunday, working in a nursing home. And it was a really good atmosphere. There was a number of student nurses working there. There was some, what I thought really cool young registered nurses there as well. And it was a great atmosphere. I remember very early on, like I was literally weeks into working there, and as a 20-year-old, it was a completely different experience for me. Um, Everything was new. I remember sitting in the nurses' tea room, and there was a lady called Dottie, who would always sit in there, and she'd sit on the stairs outside, and she'd smoke a cigarette, and she would often just chime in on the conversations that we were having. It was like she was just part of the team there. And I'm sure I said on a few occasions how cute Dottie was, and I just thought she was really the cutest thing. And I remember as we were leaving one day, I'd actually made a comment that, look, Dottie is so funny. She keeps telling the same story over and over again, and I would have heard this story in the first few weeks at least 20 or 30 times, and it was just this repetition of the story. But each time I thought it was quite funny. And then as we went back to work, the registered nurse, who I thought was just super cool, I really loved working with her. Actually said, John, it's not funny what's happening with Dottie. It's actually really quite sad. And she doesn't recognize the family. She doesn't recognize her son or daughter. She doesn't know what she had for breakfast. Has a whole life that she cannot remember. It's really sad. And that was my story of person-centered care. And I've never forgotten it. And I really looked at people differently after that. I really did. And I saw people differently, and it really affected my entire career, even to this day. So the history of aged care in Australia really starts for me with my history in really getting to understand who people really are. And that has really just stayed with me. I worked in ICU, very technical environment, but it was about promoting comfort and relieving pain. And that's the same in any setting. To me, it doesn't really matter. People are people irrespective of what setting they're in. So that's the setup. So the history of aged care in Australia. Well, this is actually really interesting for me to read. So the title says it's 30-year history, but I went back into 2 centuries ago, into the 1890s to 1920, and there it was called the destitute. The destitute were given protective asylum. So those that were homeless, or they could no longer stay at home, they were given protective asylum. And when that term became a legal term, protective asylum, the numbers tripled, and the protective asylum was so full that anyone that couldn't fit into protective asylum was actually put in jail, and that happened for nearly 30 years. Between 1930 and 1950, religious groups became involved, and they became the biggest advocates for aged care. and they started advocating for the rights of elderly care. And this is a long period of time. And it was in 1954 that the federal government in Australia created the Aged Persons Homes Act. And so the religious groups and the charities were given subsidies to provide accommodation to the elderly. And so that's where it really started in 1954, but it was accommodation. Between 1962 and 1971, there was a law called the Federal Nursing Home Benefit. And this generated, and I used a term here, an explosion in nursing care. However, the growth was scattered, the standards were variable, and there was unequal access to care. And that brought us to the 1980s. And the 1980s is considered the reform in aged care, because what they actually came up with, not just funding for aged care, not just a law for aged care, but they came up with a strategy for aged care. And this is where was the beginnings of aged care assessment. There was improved access for aged care, and there was also equity and participation by making it a national strategy. Now, that went for nearly 20 years, and that brings us to 1997, where they brought in the Aged Care Act. And with the Aged Care Act, it brought 4 standards of care. So it wasn't just about assessing people here, it was actually about setting down a set of benchmarks that could be measured. These were measured every 3 years, and a license to operate depended on passing that accreditation. There was multidisciplinary aged care assessment teams. There were funding targets by the government, so it wasn't just lip service. They actually guaranteed a set of money and budget for it. It was also back in 97 was the introduction for nationally recognised building standards. So corridor size, door size, ramps, and they had to adhere to that to be generated a licence. And there was something called a residential classification scale. Now that is still in use today, but I'll talk about that more on the next slide. Now it brings us to today. In 2018, there was a Royal Commission into Aged Care, and that came about because of some news articles and some press where people had actually videoed what was actually happening in nursing homes. So although we have benchmarks and standards, it still wasn't enough. And so they generated a Royal Commission. It was an extensive, it went for nearly 2 years. The report has only just been published after this. But even before the Royal Commission came out, there was an update from 4 standards to 8 standards. There's also a process for spontaneous auditing and accreditation. I know a facility would put a 3-year accreditation license out there, and it would go from 2010 to 2012. But you knew 6 months before that accreditation date, things would change. But with spontaneous auditing and accreditation, somebody could come in unannounced and audit a facility and audit a home. And there was transparent reporting. And really the second half of this presentation is really what is transparent reporting and how does that lead to improved quality of care. And finally, I'll also talk about person-centered care and what that looks like and how that's communicated to families and residents as well. So this is the modern history of aged care in Australia. Okay. So I mentioned before the introduction of a residential classification scale, and this really changed the game because it brought some equity in funding in care. So nursing homes were using a funding instrument to determine a residential classification scale. The level it was used by the government to determine funding for a care home. And the higher level of care, the greater the funding for the care home. So you could see here, if you're in the top 3, it's higher level of care, therefore you would get greater level of funding. Here, 6, 7, and 8 is the lowest level of care. Now this was introduced in 1997 and was used and still is used, but used right up into this terminology up until 2019. What the tool has done, though, it's a valid assessment tool, but it created a culture of labeling people and classifying people as a number. I've certainly heard this myself. That is in there. So you certainly need some model for funding, but it actually translates into having um, residents of a 1, 2, and 3 category. So it needs something more. And so in the 2020 reform that has come about as the Royal Commission, the residential classifications system and person-centred care. So it's more than a classification. And there's a number of resources that are for residents and consumers and even for nursing care staff as well. So I've just taken this one. I really like this one. There's a number of different formats. Might not be able to read it clearly, but I've made some highlights that will appear just in the blank space here in a second. But you can see somebody on admission here. So they may have passed an accreditation and have a great process for admission. But this person is asking, do they really know me? Do you really know what I want? What brings me joy, hopes, and aspirations? And so here is a health report and a care plan, but there's still a question mark. And so to know somebody well, you really have to know it's more than just their care needs, but it's about their history, what they like to eat, what I like to wear, what my interests are, and also involves my family. And so that to really know somebody well, it's more than a care plan and a health report. So I've just taken some of the quotes here and put them on the left-hand side. So when decisions are being made about my care and support, I want to be involved. I want to live the life I choose and be treated with dignity and respect. I've been making choices all my life and I want to continue to make choices. And finally, down here, I want to live the life I choose and be treated with dignity and respect. So I know this is something that we've all been saying in this conference here, but I think the beauty of having it written down on a document like this is this actually becomes the norm for everybody in this environment here. It's not just something for people who work in the industry. It becomes the norm. So I mentioned also, so that was from assessment to patient-centered care. But the aged care assessment teams, they started in 1997. Now, I've gone through this process with my mother, and I can tell you that this process, from my experience, worked incredibly well. So it's a national structured assessment to assess older people who believe they need assistance to identify their needs and choose an available service that most suits their needs. Assessment teams are comprised of a range of health professionals, and here is just a multidisciplinary team. And what the process looks like, you go onto a website, myagedcare.gov.au, and you select, I'd like an ACAT assessment. And you would then go, is it to stay at home or is it for residential care? Is it respite, so it's only care potentially on weekends or on odd occasions, or is it permanent care? And that will lead you to navigate an assessment. Okay, so that's aged care assessment. But what does it really mean? And what it really means is that it's a structured national assessment, and that's helped create equity in home and the residential care setting. So the other part of the story that I mentioned in the modern history was accreditation standards. And for 20 years, between 1997 and 2019, there were 4 accreditation standards. It was the Aged Care Act of 1997, and it set out what providers have to do for people in their care. They had 4 accreditation standards, but it also set out what would happen if they failed to meet their responsibilities. And I'm told by Steve this is something similar that you have in South Africa, where a department and auditors have the powers to enter premises, conduct investigations, seize documents, and revoke licenses. And this was conducted once every 3 years. Now, I've just written the accreditation standards out here. So first one is management of systems and staffing. So how do they ensure that they've actually got the right staff to look after the needs of the residents? Standard 2, health and personal care, people being assessed constantly. Standard 3, care and recipient lifestyle, and Standard 4 was physical environment and safety. Now, what those 4 standards created was 4 measurements, 44 outcome measures. And a facility had to meet every single one of those. It was either met or not met to actually have a license to operate. The standards look like this, and these accreditation standards could be found in every long-term care home across Australia. But I'll point out a couple of things that were consistent in this. And the first one here is the first 3 components of the standard always said exactly the same thing. First point was continuous improvement. The second one was regulatory compliance, and the third one was education and staff development. Whether it was standard 1, 2, 3, or 4, they all had their own particular outcome measures, but all 3 of them were looking for continuous improvement, regulatory compliance, and education and staff development. And so each one of those, just where those red boxes are, the standard one, they are there, but they're hidden just below there. So each one of those had those. It's excellent. I mean, it certainly worked for a long period of time. Why would we change to 8? Why go from 4 to 8? Well, I'll introduce what the new standards look like. Well, actually, before I do that, here's a case study of how they actually worked. So what an accreditation report looks like. These are still publicly available, and I've just pulled this one up. So this is St. Paul's Village. It's a Trustees of Catholic Aged Care in Sydney. It was done in 2017. They met 32 of the 44 standards. Important information, their license to operate was actually put on hold until they met these standards here. So you can see here, this one here is human resource management, not met. The continuous improvement for health and personal care, not met. Specialised nursing care and clinical care is not met. Nutrition and hydration is not met, and there were a number of others as well on the other pages. But in this report, and there's nearly 40 pages of this report, they outline the reasons why and what their expectation is to meet these. So that's actually a pretty good process. So I get asked the question, why is it that they're looking for even more standards? Well, it's not just standards, it's actually quality, what they're looking at. And so what an accreditation looks like now to present day is published by the Aged Care Quality and Safety Committee, 8 accreditation standards, spontaneous audits. There are consequences for not meeting the standards, and there's transparent reporting. And I will show you how transparent this is. I've put the website on here, and it's on nearly every page that I've got, by the way. At the start is consumer dignity and choice. So it is a real emphasis on person-centered care. I've attended a number of educational symposiums on these new accreditation standards, and this by far is the center, because consumer dignity and choice then will help understand ongoing assessment and planning is done with consumer dignity and choice. Personal care and clinical care is done with consumer dignity and choice. Services and supports for daily living is choice. Organisation service environment has dignity and choice. Feedback and complaints, human resources, organisational governance. And so that's the value of person-centred care here. It actually can help generate greater quality in care through consumer dignity and choice. So I mentioned before, I think I've mentioned a few times now about transparent reporting. How are they doing on this? So these are only brought in mid-2019, so still relatively new. And so what I did was actually I went and started looking for a report. And the way I did that is I went on to the agecarequality.gov.au site. I could look across the tab here, and I go to aged care performance and I went find a report. Oh, also there's a non-compliance register as well. I'll come back to that one. There's also something for consumers. So I can look at consumer reports where residents have been interviewed, and we can look at some resident reports as well. There's also information for providers about how they actually ought to be managing some guidelines and benchmarks for managing the facility, educational resources and education. Now, what I found interesting here is I can actually send an email or a phone call to the healthcare minister, just on tab number 6 here as well. So I clicked on that and got the the minister's email address and phone number. I didn't send an email, but that's an example of the transparency and in the reporting. So what I did is I just asked, well, how transparent is it? So I clicked the tab and I just put where I live, and up comes a care home called St. Catherine's Aged Care Service. Now I've walked past this home hundreds of times. So it's St. Catherine's Aged Care Service. Again, it's publicly available information. And so what happened is in January, the 10th of January, there was an accreditation decision, and they didn't pass the care home. It wasn't passed. What they did, though, was actually give them 6 months to improve. And so the auditors came back right on the 6-month mark here on the 7th of July, but it's still not passed. I'll go through some of the detail of what happened. And then on the 13th of October, finally they were granted their full license to operate here as well. Each one of these is a link here to the full audit report where you can actually read the auditor's findings as well. There's one of these for every single long-term care home in the country. So this is the value of spontaneous reporting because it ensures quality standards. But let's have a look at what this looks like. So St. Catherine's Aged Care Service, this is the performance report. Again, this was in Eastwood here as well, and the dates of the report. You could see, well, the personal and clinical care standard, out of the 8 standards, well, there's 7 of them that relate to personal care and clinical care, and they were non-compliant with one of them. So which one was that? Well, it was, I know it might be a little difficult to read, so I'm going to read it out. So what they found is the assessment team found that 6 of the 7 specific requirements were met. So they met 6 out of 7. Regarding management of wound care, the service does not always adhere to best practice recommendations when documenting the care delivered to wounds at the service. Wound photography is taken without the addition of necessary identifiers, the person's name, wound location included in the photographs, which could lead to photographs being uploaded into the wrong consumer's file. Wound assessments and dressing selection were found to be inconsistent and included assessment of the impact of the wound care product on the skin as opposed to assessment of the wound itself. One consumer was found with the dressing rolled up under stockings and the wound had adhered to the stockings. So this one is about wound care. And it's very specific and it has a clinical focus. But depending upon the other standard, I think, this is an example of the level of detail that they will actually go to. So what happened in July? Well, July was also non-compliant as well, and it was the same one, was non-compliant. There is more information behind this report here as well, but I am going to just jump to October, where they were actually granted their full license to operate. And there is a report there about their improvements and how they changed their protocols to actually improve. So that's an example of personal care and clinical care that drives quality care in long-term care homes. Now, I did mention before there's a non-compliance register, so all non-compliance reports are published. Even though this St. Catherine's in October were considered fully compliant, all of those other reports are still there. And so I can just go onto a non-compliance register. But but you have to then ask, well, how complex is it for somebody to actually find that. Well, once I hit non-compliance register, this is what the page looks like. In alphabetical order, I can find a facility, I can find a care home, and I can just see what standards they're not complying with and the date of that and what the regulatory action is here. I can tell for this Arcare here in Warriewood has been closed. They did not meet all 8 standards. It's a transparent process. Government funding, license depend on compliance to all standards. Finding a non-compliant facility is easy. Informed decisions can be made about choosing quality care as well. So I guess in summary, this was the brief history of aged care in Australia. It's the story of aged care, assessment and person-centred care. It didn't happen overnight. I put 2020 on there as a reason because it's only recently been written into public documents for both healthcare workers and consumers as well. The journey towards accreditation standards and quality care, well, that continues. You can see in the 80s and early 90s, though, for nearly 20 years, it was really about providing a nursing service and accommodation. But that was really important to help us get to where we were today. And so these accreditation reports are still an example of continuous improvement. And this is a quote that I really like, and that is, living well with dementia doesn't necessarily mean well in a medical sense, that is free of disease. It means enable me to live the best life possible. And with that, thank you for your participation and listening to this presentation.
Hello, John. Thank you for that very informative session. I think it's the epitome of transparency. Being able to have that kind of information at your fingertips surely is valuable to the sector. We have one question, John. It reads, has the Arjo equipment assisted homes in achieving their accreditation standards?
Yes, I think it's a really good question. So thank you for asking that. And I would say there's 3 things. It's not just equipment. Having the equipment is one thing. So the right piece of equipment for the right person. Arjo has a tool called the Mobility Gallery. You've heard of Albert, Barbara, Carl, Doris and Emma. And that is a really great, I think that tool more than anything else has really helped connect Arjo with a long-term care home. But it also, when I say it's beyond the equipment, because unless people know how to use it, well, having equipment isn't necessary if you don't know how to use it. And if the environment isn't set up, so if the doorways are small or the corridors are narrow and the turning circles are hard and there's not enough room to move anything in a bedroom, well, that makes equipment impossible to use. So having the right environment, having the right skills to be able to use it is critical. And then there's the equipment.
Very good. Thank you, John. It's always a pleasure to listen to you. We thank you for the Australian accent, and we value your contribution.
Thank you.